Okay, welcome back to our second episode
Yep.
where we are actually asking you what's the process and what do you all actually do. If let's say I'm coming to you and I say I very fatigued lah, what do you do actually?
Okay, so I guess it depends first. Like, it depends on what appointment you book. So because we do cupping on its own, or we do massage and cupping, or just massage. So okay, for the most part, usually people book massage and cupping. Okay, so first we will just analyze your whole situation. So we will ask like whether you feel any specific pain, or like, if you're just doing for general maintenance. So after knowing the specific issues, then we will proceed with massage first. So usually we will recommend to do massage before cupping.
Okay.
Because it will help to like at least calm your body down first, so your muscle will relax and your blood will start to improve the flow. So then when you cup, when you do hijama, usually the effects will be better. Yeah. So usually that's what we do. So we do massage. So after the whole massage, we will do dry cupping.
Okay.
So dry cupping at the specific areas, like based on the condition.
Okay.
Then finally we will do wet cupping.
Okay.
Ah.
So wet cupping means how do you all do it actually?
Okay, so how we do wet cupping is we will use lancet. So for some people who are acquainted with this, they will know for people who have diabetes, they go check their blood sugar. They use that pen to poke their finger. So
correct.
it's a similar tool, but then this pen is calibrated for hijama.
Okay.
So the depth of the needle is all calibrated just for hijama.
Okay.
So we will use that pen and the lancet. So we will just poke throughout the body, on the body. Then that's how we create the basically the puncture wound. That's where after that we reapply the cups. So once we suck, then the blood will start to come out.
Painful.
Okay. In
No,
terms,
I have tried it. So for me it's okay.
okay.
Yes.
So maybe for yourself, how would you describe the pain or like the sensation?
Oh, I really
It's
don't know
like
how
an
to-
ant bite.
Okay, ant bite. So
Yeah.
usually that's how people will describe. But then again, ants also got like black ants, got red ants. Yeah, so some people their pain tolerance are lower. I got some customers going saying like it feels like a stapler gun on their body.
Oh, okay.
That's how some people feel. Some people even feel like it's just like a tickle. So it really depends. So I can't really say whether it's painful or not. It depends on the person.
For me, it's a very helpful end lah, I think.
Yeah, for me also. It was just like an ant bite.
So
Yeah.
when you actually, why do you all suck out the blood? What is the necessity to actually draw the blood?
Okay, so some understanding they say like we want to remove the bad blood. So but then the idea of hijama is actually not to remove as much blood as possible, but it's actually to create that basically that damage. So when we puncture the blood vessels, right? So your body's response is to actually create new blood vessels at the same time to send more blood to the area for recovery. So like our body has this self-healing mechanism whereby if they sense any damage within certain areas, they will send more blood to the area for recovery.
Okay.
So that's why we will like when they have the pain in that certain area, we will puncture or we will make incisions on that area as much as possible. So that's when the recovery will start to kick in the area.
Okay. I have a question. Okay, been wanting to ask. They say, some say, I don't know.
Okay.
More blood is better, less blood is better, or
What
which
is
is
what?
which?
Okay, so I guess this is actually a bit hard to explain because it depends on the person's body factors. Even sometimes depends on when they do also will affect how much blood comes out. But sometimes yes, it might indicate like certain areas where there are damage. The area that has more damage will tend to release more blood. But on the contrary, for some people who have poor circulation, the areas that there's damage has lesser blood.
Okay.
So it's really hard to tell. So it's like sometimes it depends on their condition.
Individual.
So it doesn't matter whether less blood or more blood lah.
No, the amount of blood doesn't dictate whether the results of the cupping is good or not. It's really the doing of the incision itself. That's the most important part to break down the blood vessels. Yeah.
So along the line, you were saying that you are sucking out the bad blood. So when you said that, that actually rings a bell.
Okay.
Okay. Someone told me that when we do hijama or when we do Bekam, it not only removes the bad blood. It removes whatever unseen things that is in your body. How far this is true?
Are you talking about spiritual things?
Maybe, yeah. No, that's what I heard. I don't know.
Okay,
Maybe
okay.
the person who told me meant it in that way. Or I'm saying the bad, unseen things in your body. lah.
So, but before we cover that, we just want to make sure that we understand that hijama doesn't remove bad blood alone.
Okay.
That one must be clear first, because people understand, we remove bad blood because our body cannot actually distinguish which is the good blood, which is the bad blood. It's just that when you do hijama, it removes the blood that contains the waste product of the body. Okay, so going back to that topic, so actually, because in Islamic practice itself, there is belief that these unseen forces can actually live through our blood. So there are basically Islamic practitioners who actually use hijama as a means to remove these things. So yes, it's true actually. But ourselves, we don't practice. We limit ourselves to medical practice only.
I see.
Okay. Oh, that's another.
Yeah, there's additional practice on top of just hijama alone.
They call it Bekam Ruqyah.
This is Bekam Ruqyah. So what they are doing is
Different lah.
It's just,
it's just hijama.
so we don't want to mix. So if they want to do for that case, we will push them to the experts.
Okay.
Yeah, talking about experts and practitioners, how do you all actually certify yourself? Yeah, I mean, do you all go for course, or are you all certified in Singapore to do this? I don't know whether I'm okay to ask this question.
In Singapore itself, there's no certification needed for hijama.
Yeah.
But for like customers trust, we go take courses outside lah.
Okay.
Yeah.
okay.
So the person we learn from is a doctor, a professor in
professor.
KL.
Oh, okay.
Yeah. So we felt very comfortable with him, like more confident when we learn from him. Yeah, because he really teaches us like the medical stuff, the clinical stuff. So with him, we were taught a lot of things.
Does he also do hijama, or he?
Yes.
I see.
You want to tell a bit about Prof Aziz?
Okay, go ahead.
Yeah, Fina, I think you need to talk.
Scissors, paper, stone. Scissors, paper, stone. Yeah.
Okay, yeah. So Prof Aziz is basically, he's a senior specialist doctor. He has been he's been a doctor for more than 30 years. At that point when I was
Malaysia?
in
Yeah,
Malaysia.
Malaysia.
Yeah,
Where in Malaysia?
Where?
Shah Alam?
Not too sure. But then right now he's based in Kota Baru in Kelantan.
Okay.
Okay, I don't remember. Yeah, so when we were taught by him, he was already he was a doctor for more than 30 years lah. So he's the doctor who will go in the hospital. He will go every morning, go to bed, and say and give the final say. Okay, this person need to cut leg. Okay, this person. So he's the person. Cut leg. So he's the one who gives the final say. So he has very good knowledge in the medical background lah. Yeah. So then along the way, he was thinking to himself like, how come my patients are not getting any better? How come when they come back, they have to take more medicines instead? Yeah. So then he was like questioning himself lah, like. Then he realized that medicine also has a lot of side effects, like long-term side effects, which he realized like, okay, I'm doing something wrong. So then after that he come across the hadith about hijama, right? Yeah. So then he realized that, okay, I'm a Muslim first before anything else. So why not I trust my Rasulullah, right? So, but then he didn't want to stop there. He wants to have a clinical research done on hijama itself. So he gathered like a few people, PhD holders, to do a research and got government funding to do a research on hijama itself. Yeah, so after that, from there, then he got a lot of research studies saying all this and this lah, like it can help with this, help with that. So that's why we felt very confident learning from him. And the fact that we had a direct contact with him until now, and he still remember us as Singaporean students, like he always remember us. Yeah, then in fact, like he will ask his customers from Singapore, his patients from Singapore to find us to do hijama with us.
That's nice.
Yeah. So I guess this is one also why we are not scared to do people with medical conditions, because we are very confident in him also.
But so far, you all have not faced anything from the Singapore government bodies lah, saying that you're not supposed to practice.
No. Yeah, because we are very safe also. So they say as long as there's no what they call it,
No operation.
complaints.
No.
As long as
Serious
there's
cases lah,
serious
basically.
cases,
Yeah.
complaints, people won't say anything lah.
Okay.
Talking about serious cases, sorry, this one
It's okay.
I talk lah. You keep quiet.
Yeah, he likes to talk a lot actually.
Yeah,
so
actually, I
he
do
thought
talk a
I'm
lot.
actually dominating or something. So
No,
never
no,
lah,
no,
I kasih dia chance
Take
lah.
lah.
Take lah. If not, I can go home kena hantam. Okay, anyway, bro, I want to check with you all. What is your most critical case that you all have ever done?
For maybe I think yours lah, the
Which
lady.
one? Which lady? So my memory very bad.
From the one that cannot talk, then can talk already.
Oh yeah,
That's the most
that
critical
one.
case that we have.
She came.
Yeah.
She had this cerebral
Ataxia.
ataxia. Cerebral ataxia. Yeah, I know. That's slow a bit only. It will come. Yeah, so she, of course, it didn't like cure her condition, but improved her symptoms so well. Because there's no cure to this. She's like the only one out of very few in Singapore that.
This is the only one in Singapore.
The only one in Singapore suffering from this. Yeah, so when I came, she was shaking, really shaking very badly. She couldn't talk. So she had to have her doctor beside her to talk to me lah. So then after that, when I did for her the hijama, on that day itself, after I did it, he called out my name.
Wow.
Yeah, and then I was like goosebumps. Yes, I was really like, wow, mashallah, really. I was speechless myself because even my doctor said like he don't know whether it would help, but then it's safe for her to do. So I was like, macam, wow, okay. Then after that, okay, I left. Okay, she sent me to the door. She couldn't walk before that. She sent me to the door after we finished the appointment. She stood up and she sent me to the door. So I was like my heart was like really, really. Yeah. Then after that, the next day, she woke up. She immediately texted me, I think. She said like that morning when she solat subuh, she said she could recite all the dua out loud.
That is a miracle.
It is.
Mashallah.
It's really.
Even
mashallah.
doctors, I think the doctors couldn't do it.
Yeah, the doctors. couldn't
That's
do
why
it.
one of the video I saw, you say, don't need to go doctor, you come and do it.
After that, I said kidding.
But I never hear the kidding part. I only heard that.
See, he really saw it, now he counter already.
Yeah, that was my best lah.
Yeah.
Okay. Then how about yourself?
Honestly, I don't have any critical cases.
Maybe I will come to you lah.
Yeah. I mean, stroke is not that critical because most of them, I mean, not miraculous enough.
So that means you all also do for stroke.
Yeah.
Yeah.
What
Okay.
else?
I guess I'm not serious. I don't know if this is considered serious. Gout. Okay. I got a customer, my current customer. He had been having gout attacks weekly. So usually you can hear people like maybe once a month a gout attack. So his was weekly. Then he did about 4 to 5 sessions with me, and he stopped having gout attacks for at least 2 months already.
Oh,
From having a weekly attack to not having gout attacks anymore.
wow.
Yeah. So like now still under observation. So we are trying to see whether it improves overall for his gout. Yeah.
Is there anyone or someone that you all do your therapy that it failed?
Failed. I mean,
Feel no, but like no
improvements, I guess.
no improvement.
For now lah, maybe.
Maybe for now.
But once they see like nothing okay, normal, nothing, no difference, they wouldn't do again.
Yeah, that's a sad thing lah. Some people like once they do one time, they feel like no difference, so they stop.
Yeah,
But
but
I think why they don't feel. I mean, why some don't feel the difference?
Maybe
doing
they
once.
don't believe in it. Could be right.
I
I get
wouldn't
that.
say so.
I guess okay because there is I would say saying maybe like healing is also partially mental. So sometimes if you have the intention to heal, right?
Yeah.
So sometimes even if you don't have the intention, you don't try, right? No matter what you do, also it's a bit hard because
Yeah,
it's sometimes psychological. So
Yes, correct.
yeah.
Very
So
correct.
when they try, then maybe because it depends on the condition. If the condition is very serious, sometimes one session is not enough. You
Yeah.
need a few sessions before it starts to slowly kick in. Maybe internally it helps, but they don't know. Yeah. Sometimes they physically feel not much difference, but internally you don't know what's happening. Yeah. So we believe that hijama helps internally. That's why when we learn hijama scientifically, we need to understand like what's going on inside. So even if you don't feel anything different outside, you need to know that there's something happening inside. That kind of thing.
And that's on our part lah. I believe like when we meet our customers, we should tell them like you might not feel any effect, but this is what's happening inside. Me personally, when I do hijama, I don't feel anything. I feel no difference at all.
Okay.
But I know for a fact that it is beneficial.
But then for you, your
because I
allergies.
don't.
Your
I
allergies.
don't feel it right immediately right after.
Okay.
But like along the way, then I realized, like certain things I can do that I haven't been able to do previously.
Ah.
So it's like because I do it every few months. Then after that, I'm allergic to seafood. Now I'm no longer allergic. I can eat seafood.
Her throat used to close up when she eats crab.
Yeah, but I still eat because I want crab very nice. Cut the crab. Cut the crab, I eat it.
But then like after hijama, alhamdulillah, actually her allergies stopped. I think.
Yeah, so like my lips will swell up.
Yeah.
No, nothing.
Got anybody got complain about you all not before? Complain or
where got?
No need about client lah. If let's say if I ask you like your competitors got anybody got complain or bad mouth or just to pull your your business down?
There's always a competition.
Yeah, of course there is. Mainly more to like maybe timing because sometimes different places before previous customer got lagging a little bit, so it got go forward. But other than that, regarding our treatment itself, I have never gotten any bad reviews.
Yeah, I guess partially because one of the challenge that we face is because we do mobile, so we do houses to houses. So sometimes in between appointments we take time to travel, so we do get maybe some feedbacks regarding that.
Timing wise and
timing
all.
wise.
Yeah, and then sometimes they complain to another company. So it's like it's fine. Yeah, but the thing is, my therapist will always tell them in advance. Maybe like 5-10 minutes late, that kind of thing. Yeah, sometimes we cannot help. Like previous customer got some complication, we really cannot help. Then we have to finish it up, Yeah. So if we, So other than that, do we have other complaints? I
think about the treatment itself. Not that we know of.
Yeah, I don't think like action like that.
But I guess alhamdulillah so far, I guess no one came back to us regarding like having suffering from any serious issues because of the cupping.
Yeah.
So you guys only do house calls?
Yes,
we do house calls.
Oh, house calls only.
Yeah.
So
Because my wife was saying that you all got studio lah.
We
We
used to have,
we used to have.
but that was very short period.
We used it's a training center because that time we taught Bekam. So that place we lease that place only to train people hijama.
So are you all still doing it?
I don't know.
If let's say I want to come and learn it from you all,
we actually do it like private session, like 1-to-1 we do.
but will be like certified? Do you get certificate?
Yes.
I thought you want to ask something like about how many cups to use or
Wait, that one come back later. I got one more question before I forget.
Right.
You see, like I forget already. What I want to ask. Okay, how much do you all charge?
Okay.
Malu.
Okay, so our price starts from 100.
97.
Oh right, 97. So that's for fertility hijama.
Okay.
Then it depends if you add massage, everything there'll be different lah. So but minimum is $97, and that's the fixed price. There's no transport charges.
Okay.
So
There are so many that I've seen. There are so many companies that are doing hijama and Bekam. How do you tell yourself that you are standing out from them? What is the catch? Or how do you all make yourself stand out from the others?
Okay, so I believe that our selling points are because we treat people with medical conditions. So that's why we have like all these fertility hijama, gout hijama, then hijama for like diabetes, high blood pressure. Because we found out from a lot of people that they didn't know that cupping can help with these conditions. They thought cupping is just for like body pain, headache, migraine, not to the point of medical condition. But then we have customers like having diabetes, going for hijama few sessions, then they go to the doctor, check the blood sugar went down. So it's like there's the benchmark, because they go for checkup. So the results can't lie.
And we don't do like general points. Like if you have specific condition, we know specific areas to do it for you. And then we know like the frequency, like how many times you need to do in a month. Like if you are at stage 4, how many times you need to do? If you are at stage 1, how many times you need to do? These are things.
Have you all cured any cancer patients?
Cancer patients we have treated. I have never cured lah. I think people still scared on that point.
Okay.
Yeah, but I do have like my professor has actually managed to take people from cancer stage 4 to stage 0.
Wow.
He has done it. But of course, that is with proper care. Everything, diet, everything. You stay in his place, he will prepare everything for you. Not just Bekam only lah. So with food and exercise and everything.
There's
It's
a whole
a
package.
package.
Yes, like but we don't do that lah. So usually when my cancer patients, I would say go to Prof Aziz, go there and like heal there. Yeah, some of them actually listen and went.
Okay.
So if let's say, stupid question.
Memang we
No,
like
all this why my questions have been stupid. Okay. If let's say a person diagnosed with AIDS, he wants to do a Bekam, how do you all actually tackle him? Will you all still do a Bekam
I
for
will.
him?
I will.
Yeah, I have done for someone who has HIV and hepatitis C. So like this kind of condition where it's like bloodborne, but then like because for us we use clean equipments, we use disposable equipments. So inshallah it's safe. So whatever that we use on our patients, we will throw away. So the risk of infection is very minimal to none lah, inshallah.
But were you all scared to do? You're handling blood and all. Have you ever thought, wow, something might happen to me?
Because from my doctor's point, he said like whoever comes in, you always expect they have the worst condition. So you will always take care of yourself, not just for and the other people, the next people coming in. So we will always like, no matter what, we will make it extremely clean, sterile, and clinical. So we are not scared. Honestly, I'm not scared at all.
So basically, from what I hear, they have done a lot of people with a lot of conditions.
That's why. That's why it is like very.
Someone who can't talk can actually talk.
Yes.
I mean, that
You
is
must have
that
felt
is a
that.
miracle.
Yep.
That's why we're in this.
Yeah, I love it. That's why whenever we get these miracle stories, I will be like, this is the reason why I do this, and I will never go back. I've stopped taking appointments. I told him personally, I miss doing hijama on people because I miss having this feeling like when people come to me and it's like, Fina, like you help me, like, it's like this is not me, like it's Allah lah, right? But it feels good that you are the helping hand, right?
Yeah. When it comes from you, you feel the satisfaction.
Yeah, like you have a part in
what
it
you
lah.
do and you do what you like.
I love what I do.
Yeah. Okay. I have a question. I think you came up with some sachet that helps
Got sample
women.
Free sample.
that, women who are having difficulty conceiving. So can you tell us?
Okay, so basically like I know people do hijama, fertility hijama, right? So like I want to add on something to it. Like I don't want it to be something that you do only once in 2 months, once in 2 weeks.
Okay.
I want something to add on to it. So that's why I come up with this. It's actually a jamu. Yeah, so I made sure I got all the ingredients that I wanted.
Okay.
And then we did some R&D, we tested it, we tried it, and then everything went well. So I took it out. So I want my customers to also have something on a daily to take to improve their fertility lah.
It only helps fertility only or kedalaman juga?
Actually, it's all overall womb health. I just want to market it as fertility booster, but actually it's just a womb health lah.
I cannot eat lah like that.
Cannot. Male cannot eat.
So this is not for men lah.
Cannot, man cannot, because it will kill some sperms. If
I
if
think
men
it's about time you find something for.
Yeah.
Yeah,
I mean, like,
we are. It's in the works actually.
So like we are
Oh,
just
nice.
testing out. So right now we're just focusing on the female side first. Then in future we'll like add more products for different condition lah. Inshallah. That's our plan.
Where do you actually do this? I mean, this product that.
It's in Malaysia. The Kilang
Factory.
The factory. The factory is in KL lah. Yeah, so I go back and forth just to see the stuff.
So it's certified in Malaysia.
Yes, it's GMP. All the certification that is needed is all there lah. It's all safe. Yeah.
You did all the research, is it?
Yeah,
and
I got it
whatever
lab
ingredients.
tested also. Yeah, so it's all lab tested. All is very safe.
Yeah, so it's basically the formulation is from her. She choose the ingredients. So they just do the R&D.
Bro, I'm expecting yours soon.
Inshallah.
It'll still be mine. You just do your hijama lah.
I think it's both of y'all, right?
Well, without him, I'm not able to do this lah. Honestly, like I cannot. If you don't let me go, I cannot.
What's there to see? I don't see anything.
Yeah, right.
What's there to see? I want to see this story. What is going on?
No, we just always joke like that. And then he likes to, cut like that. Yeah. So
You got anything else to ask them?
why?
No, I'm giving you the opportunity now.
You know why he's doing this? Because last week I said you talk a lot and you never give me chance. So now you see?
Yeah, you want to ask me anything?
Now you see.
Yeah, now I see.
Cannot talk.
So anyway, guys. Okay, cut the crap.
Sorry.
Okay. It was actually very, very, very fruitful listening to you guys. You know, it was actually. I see a miracle person here who does miracle, and maybe you are the next.
Yes.
Okay. I'm really, sister. I'm really very amazed.
Mashallah.
Yes,
Mashallah.
yes.
I'm very
Really
amazed.
touched us.
Yeah, that
I'm
somebody
feeling
who
it,
can't
actually.
talk. You know, you are doing this help. It's a charity that you are doing for people. I mean, inshallah, may Allah bless the both of you. Okay, and thank you so much for coming down, taking your time. It was really a blessed one.
This is Nurul Huda Podcast, your weekly dosage of interesting and inspiring stories.